My name is Warren Terrell, and I have the honor of being the chair of the board of the Institute of Health Economics. On behalf of the board and our CEO, Egan Johnson, and the whole IHE team, it gives me great pleasure to welcome you here to the 16th IHE Innovation Forum. These are regular forums that are held twice a year in conjunction with our semi-annual board meetings. They started in December of 2008, and this is the 16th of these meetings. I think it's been very successful, and they've become an important part of our healthcare landscape. People enjoy coming out to the innovation forums. They provide a great opportunity for Alberta health system leaders to gather and to learn from international thought leaders and experts in particular topics. They also provide a chance for Alberta health leaders to discuss informally how those lessons might be applied to the province. As we've said before, good things happen when we bring good people together and give them a chance to talk. The IHE is pleased to provide these regular opportunities for the health community to connect and collaborate. We always try to select topics that are timely and relevant to our forums. Today's forum is focused on community-based health care. We have an outstanding acute care system in the province. However, we understand for improvement of the health of Albertans and sustainability of the system, we need to improve our primary health and community care systems. This is a key focus of our minister and the current government, and I'm sure our deputy minister as well. I look forward to these discussions around this topic today. But before I introduce the first speaker, I'd like to take a few moments to thank some people. I would first want to thank the board of directors of the IHE. I would also like to, this is a unique organization that brings academia, government, and health system leaders from public and private sectors together in this system. The problems we face in healthcare are so challenging and complex that they are only solved through meaningful partnerships. I'm pleased to lead an organization which embodies that partnership sentiment is very important to this solution, or these solutions. I would also like to take this opportunity to offer a very special thank you to Dr. Egan Johnson, the CEO of the Institute of Health Economics, and this will be his last Innovation Forum. Under his leadership and the support of the IHE team, the Institute has become a thriving organization recognized nationally and internationally. I would like to take this opportunity to thank him personally for all his contributions to the Institute and to Alberta. He was an international and is an internationally recognized health economist who brought an international profile to the IHE. He made it the Secretariat for HTAI and for INATA. And the secretariats are housed in the IHE, and this gives us an international profile with between 5,000 and 6,000 scientists recognized in this organization, recognizing the IHE and Edmonton. He brought in and introduced the innovation forums in December of 2008. He also introduced consensus conferences. There's been 7 of them, and they have been very important in much of the discussion on how we mold healthcare in the future. He's an international figure in improving health systems by supporting the greater use of evidence in health systems decision-making, and also supporting efforts to address the most vulnerable in society. He has strong interests in mental health, and he has very strong interests in FASD. Thank you, Egan, for your outstanding contributions to the Institute and to its efforts to support improved health for all. I just want to say it's been very special, your leadership in seeing how the IHE has developed over the last 12 years. Thank you very much, Egan. I also want to say that there is a news release that went out this morning, or going out this afternoon to some of you. The news release will announce the new CEO and Executive Director of the IHE, and it is Dr. Christopher McCabe from the University of Alberta. Chris McCabe has got a strong and long history in health economics. He got his PhD from the University of Sheffield in the UK. He has also had a long history of interacting and working in the UK with NICE. NICE is a major organization, and he's had several roles with NICE from 2003 to 2011. For the last 6 years, he's assumed the role of Capital Health Endowed Chair in Health Economics at the University of Alberta in the Department of Emergency Medicine. During his time, he's also led PACE Omics and Precision Medicine Policy Networks as a principal investigator. He's published over 200 papers internationally, and he's been a consultant in Europe, North America, Australia, and certainly has had a major role in the Faculty of Medicine at the University of Alberta. We're very pleased that Chris, after an international search led by Boyden, was selected as our new CEO. Unfortunately, Chris was not well last night and is not here today, but he will be with the board tomorrow. But I just want to welcome Chris to his new position. Now I would like to introduce our Deputy Prime Minister, Mr. of Health, Mr. Carl Arnhem. Dr. Arnhem was appointed Deputy Minister of Health on August the 4th. Prior to this, he served as an official administrator for Alberta Health Services after a long tenured term as professor and provost of the University of Alberta. Dr. Arnhem has been a strong supporter of the Institute, and we're pleased to be involved in many efforts underway to transform Alberta's health system. We couldn't ask for a better leader to do that. His current role in leading provincial efforts to build a more community-based healthcare system is ideally suited for today's topic. I would like to now call on Carl to say a few words.
Thank you, Dr. Terrell, and good afternoon, everybody. And thanks to the invitation for the opportunity to bring greetings on behalf of the Government of Alberta and Alberta Health at this Innovation Forum. I'd like to express my thanks to the Institute of Health Economics and John Sproul and Dr. Terrell for convening these important policy discussions on a regular basis. The ongoing innovation series is an important opportunity to focus on issues of relevance today. The Institute of Health Economics is an important partner with the Government of Alberta in providing independent evaluation and policy analysis on a wide variety of important topics. Thanks to the IHE for their help to our ministry, and recently for co-hosting the Policy Forum on Physicians as stewards of public resources. This event was the kickoff to the last round of negotiations with the Alberta Medical Association, and it played an important role in setting the stage for what became very successful negotiations that culminated in a signing ceremony in November. The new amending agreement recognizes a shared responsibility to provide quality health care in a financially sustainable framework. And even more than that, it puts in place a strong foundation of partnership and collaboration that is going to serve us very well in the months and years ahead. And perhaps we should imagine John doing another one in the not too distant future. Your topic today, building a community-based health system, is a very timely one. Community-based care is a priority for our minister and the Government of Alberta in order to meet the challenges of changing demographics. The challenge of increasing demand for quality and accessible health care, and to improve Albertans' access to the health care that they need, when they need it, and where they need it. Minister Hoffman has talked about our agenda to move from the traditional focus on hospitals and facilities to a more community-based and home-based level of care. We are doing that through 5 major action areas, working with physicians on improvements through the new amending agreement that I just mentioned, strengthening and improving primary health care, and there's an important role in the amending agreement on primary care networks, providing continuing care close to home, improving health information management in the healthcare system, and creating better access to mental health and addiction services for Albertans. As we discuss how to build a community-based health system, I would like to briefly touch on a passion of mine, and that's the belief that we must tackle the challenge of healthcare integration head-on. It's the challenge of having a complex healthcare system with many different moving parts, many stakeholders, and figuring out how all of the parts can work together. And the challenges of ensuring patients come first and don't fall between great institutional cracks. I've been hearing about the integration challenge since the day I became involved in healthcare, and to be honest, it was much earlier than that with Lauren Terrell around August of 2003 when I first moved to Alberta and we talked about the Alberta Laboratory experiment. The key elements of success in this regard, I believe, is having good information. We need solid, reliable, and accurate data. We need evidence to guide our planning and our decision-making. We need to have strong inputs into our decision-making bodies, from cabinet and the legislative assembly all the way down to the front lines of healthcare delivery. We also need to bolster the province's data collection systems and processes, which we're doing through several key initiatives, including some that arise out of the amending agreement. Data integration and a strong system performance will lead us more easily to a fully integrated system, a system that includes data to show what's working and what isn't working, a system that provides access to information for individuals. This afternoon, I have an unusual opportunity to spend an hour so I can listen to the first keynote speaker. And he is a very prominent speaker on community-based healthcare systems. And the advice of all of the speakers this afternoon will be important as we continue this work in Alberta. And the panel this afternoon is particularly well qualified to comment on these issues. Much of the work that you'll be seeing come out of the ministry in the next 6 months has started with the research of Richard Luanchuk. Brad Baylor and Carolyn Trumper have been giving me advice, and many others for the 30 or so months since I've crossed the river from the university. And Kathy Ness has the distinct honor, perhaps, in being responsible for half of the initiatives that will be coming out of the ministry in the next 18 months. So if Kathy Ness appears to be a little tired at times, you can help her by just saying, yes, you're right, and then she can move on to the next challenge. And our visitor from the Mayo Institute, some of you know I used to, long time ago, teach statistics. Well, I'm going to miss it, but you're in for a real treat. When I was at the Mayo Clinic studying how they do things recently, I had the great pleasure of sitting through what probably are the most statistically sophisticated presentations of integrated healthcare that I've ever seen. So if you like statistics, then buckle your statistical seatbelts because you're in for a statistical epidemiological tour de force. So thank you again for the invitation, and look forward to talking to all of you as the months ahead come by.